This is a routine phacoemulsification. Here I am doing it's around grade 1 to 2 nuclear sclerosis, dense PSC. Done my incisions, put in my HPMC. I'm putting some HPMC over the cornea. I go ahead and fashion my 5.5 mm rhexis. Now the plan is to go ahead and do a quick chop method, but just see how I have to improvise. There was a little bit of I think I'm having some focusing issues there. Yeah, I'm just trying to focus it. But you can see that the rhexis is more or less complete. Yeah, that's the complete rhexis. I then hydrodissect the epinuclear nuclear complex, and once that's done, just giving another hydrodissection wave, pressurize the chamber with PSS, rotate the nucleus with my Sinskey hook. It's well separated. I then go ahead and I'm going to initiate my quick chop method, just aspirating some free cortex, and look what happens. I'm trying to impale this nucleus, but it is just too soft. So I immediately change plans and switch over to, rather than continuing with my quick chop, I switch over to stop and chop. Just changing the parameters, and I'm going to make a central sculpting, and you can see it's very soft. Just widening the trench and now deepening it. This is very important. You have to have a wide trench to accommodate your sleeve. Just rotate it. I'm going to deepen it from the other side as well. You don't have to go right to the periphery. Once that's done, make sure both your instruments are deep within the trench and separate, laterally separate. So there it's separated, rotate it, and again go towards the mid periphery and separate. Separated, but the center is still attached, so I separate it in the center as well. Once that's done, just go to the peripheral part of the nucleus and try to bring it out. Break it into two halves and start eating it. This is very, very soft. So I rotate the other heminucleus. These soft nuclei are pretty difficult sometimes. And you can see how it has just flipped over. So I tried to auto fracture it, doesn't happen. So I have to improvise. Try to bring out one end, and there it comes. So once that's all done, I decide not to go ahead with my phaco probe to aspirate the cortex because the pupil has come down a bit, and I decide to go ahead with my bimanual. It's a little bit safer. I more or less use my bimanual like a coaxial, so I don't keep switching hands if I can help it. And that part is done, and this is very easily done. I then hydro implant my single piece hydrophobic IOL within the bag directly. Just using a Senski hook to tap it into place. It's well in place. I then hydrate my wounds, put in my intracameral antibiotic, and conclude the surgery. Thank you so much.